have a lot of unique needs here at Yuba County. We have a lot of anxiety, depression, and then family dynamics that go on. We have a low socioeconomic area, and we also have some affluent, but we have multiple diversity within our ethnic groups and within our families. You have families that really do not talk about mental health, and then you have those who the families are really wanting to seek all the help they can possibly get.
Having grown up in this area, been an educator for so long, I know what our needs are, I know what our strengths are. And our students and our staff are all so resilient. But the thing about resiliency is you want to create the conditions where you don't have to be resilient anymore.
As a district, we've really prioritized and seen the need for comprehensive mental health support here on campus, especially given just where we're located. We're a really rural area. There's really no providers out here. And so the school is really it.
We all really care about children and youth, but sometimes educational partners, they're saying a language that healthcare partners don't understand. So I try to educate myself on both languages so that I can be that bridge, that translator.
So our public health has been such a huge partner in our wellness work. Our wellness center model is Yuba County Office of Education, Yuba County Health and Human Services, and our FQHC Peachtree Health. So we really all came together to make this possible. So CYBHI and CalHope have, again, not just been foundational in building our centers, but sustaining our centers. And that also has given us hope for the future. Because of this funding, we are able to not only build relationships with these kids, but also give them the tools necessary to teach their peers.
The Wellness Center here, in addition to the timeliness of the needs, the severity of the needs, the biggest thing has been the immediacy of the response. It's not a 6-week wait for a referral and then a 6-month wait for a spot. It's kids in crisis, somebody needs help, they can be seen that day.
It's been so impactful for the students because of the transitions we've experienced here, of the hardships and tragedy and other things that our population has experienced in this area. They get the extra support that is so needed and creates the opportunity for parents to not have the barrier of needing to take a student off campus or even into the next town over to find that support that they need.
A lot of our positions to staff are our therapists, looking in the future to being able to staff wellness coaches, being able to bring in additional interns to help allow other people to learn what this space is like. We're constantly being able to add on additional pieces to our program, which I think has been really, really beneficial in order to think of longevity.
I am seeing more and more students take responsibility for their own mental health and their own mental awareness, and they are accessing it because it's available on campus.
I finally know how to manage my emotions, who to reach, connect my feelings, and find reasoning.
I had a lot of rocky moments growing up. When I first came to the school, I was very closed off. But now as a senior, I can say if I feel like I am struggling, I go see my therapist, I'll see my academic counselor on campus, and I can't wait to take everything I've learned here onto my college years.
There are times where coming even to the clinic or even a wellness center can be too intimidating for the youth or even too intimidating for the parent. They just want to do it at home on an app. These apps are wonderful for that, where it's just you're dipping your toe in, you just want to kind of ask someone in a no pressure way, what does it mean to be anxious?
We are going to offer a county-wide safe spaces training. So our district showed heavy interest, and at the county-wide level, we want to support professional development. So the same way we want our students to develop skills, we also want our staff to have those skills.
And through CalHope, through Saluna, through places like the Zen Den, we have now access points for our students to have a place to go and somebody to respond.
Even out in this rural county, that maybe mental health services is not something that's been widely accepted or maybe even understood or supported, is suddenly becoming this central element of our campus, really destigmatizing mental health.
Now that I am a senior, I look back and I realize of all the support I've received here, my graduation is the thing that's really giving me hope that everything's gonna be okay. I'm going to go to college. I'm going to make my mom and my sisters proud.